Asthma is a chronic respiratory condition that affects millions of people worldwide. It is characterized by inflammation and narrowing of the airways, which can lead to symptoms such as wheezing, coughing, chest tightness, and shortness of breath. Understanding how asthma develops over time is crucial for effective management and prevention of complications. In this video, we will explore the stages of asthma development, from its early onset to its progression in adulthood, and discuss the factors that influence its course. Let's begin by looking at what triggers asthma in the first place. Asthma often begins in early childhood, sometimes as young as infancy. During this period, children may experience frequent episodes of coughing, especially at night or after physical activity. These symptoms are sometimes mistaken for recurrent respiratory infections. Genetics play a significant role, as children with a family history of asthma or allergies are more likely to develop the condition. Environmental factors, such as exposure to tobacco, smoke, air pollution, or allergens like dust mites and pet dander, can also contribute to the early onset of asthma. Recognizing these early signs is important for timely diagnosis and intervention. Genetics are a key factor in the development of asthma. If one or both parents have asthma or allergies, their children are at a higher risk of developing the condition. Certain genes influence how the immune system responds to environmental triggers, making some individuals more susceptible to airway inflammation. However, genetics alone do not determine asthma. Environmental exposures and lifestyle also play crucial roles. Understanding the genetic component helps in identifying at-risk individuals and implementing early preventive measures. Environmental factors are significant contributors to asthma development and progression. Common triggers include air pollution, tobacco smoke, pollen, mold, dust mites, and pet dander. Children exposed to these irritants, especially in early life, are more likely to develop asthma symptoms. Urban living, with increased exposure to vehicle emissions and industrial pollutants, can further elevate the risk. Reducing exposure to these triggers can help prevent the onset or worsening of asthma, especially in genetically predisposed individuals. Asthma involves an overactive immune response to harmless substances, such as pollen or dust. When these allergens enter the airways, the immune system reacts by releasing chemicals that cause inflammation and swelling. This leads to the classic symptoms of asthma. Over time, repeated exposure to triggers can make the airways even more sensitive, resulting in more frequent and severe asthma attacks. Understanding this immune response is essential for developing effective treatment strategies. The hallmark of asthma is chronic inflammation of the airways. This inflammation causes the airway walls to swell and produce excess mucus, making it harder to breathe. Over time, persistent inflammation can lead to structural changes in the airways, a process known as airway remodeling. These changes can make asthma symptoms more severe and less responsive to treatment. Early intervention and proper management are crucial to prevent long-term damage. In children, asthma symptoms can vary from mild to severe. Common signs include frequent coughing, especially at night, wheezing, shortness of breath, and chest tightness. These symptoms may worsen with physical activity or during respiratory infections. Some children may experience only occasional symptoms, while others have persistent problems that interfere with daily activities. Early recognition and management can help children lead active, healthy lives despite their condition. As children grow into adolescence, asthma symptoms may change. Some teenagers experience improvement or even remission of symptoms, while others continue to have persistent or worsening asthma. Hormonal changes during puberty can influence the severity and frequency of symptoms. Additionally, lifestyle factors such as increased exposure to allergens, stress, and changes in physical activity can affect asthma control. Regular monitoring and adjustment of treatment plans are important during this transitional period. While asthma often begins in childhood, it can also develop for the first time in adulthood. Adult-onset asthma may be triggered by occupational exposures, respiratory infections, or new allergies. Symptoms in adults can be more persistent and may not respond as well to standard treatments. It is important for adults experiencing new respiratory symptoms to seek medical evaluation, as early diagnosis and management can prevent complications and improve quality of life. Asthma triggers can change as a person ages. In childhood, common triggers include viral infections and allergens. As people grow older, triggers may shift to include occupational exposures, stress, hormonal changes, and even certain medications. Recognizing and avoiding personal triggers is a key part of asthma management at any age. Keeping a symptom diary can help identify patterns and inform treatment decisions. With persistent inflammation, the structure of the airways can change over time. This process, known as airway remodeling, involves thickening of the airway walls, increased mucus production, and changes in the smooth muscle surrounding the airways. These changes can make asthma symptoms more severe and less reversible, even with treatment. Preventing airway remodeling is a major goal of long-term asthma management, highlighting the importance of early and consistent treatment. Asthma is characterized by periods of stability interrupted by exacerbations or asthma attacks. These episodes are marked by a sudden worsening of symptoms, often triggered by infections, allergens, or irritants. During an exacerbation, the airways become even more inflamed and narrowed, making breathing difficult. Prompt treatment with rescue medications and, if necessary, medical attention is essential to prevent serious complications. For some individuals, asthma symptoms become chronic, occurring daily or almost daily. Chronic symptoms can include persistent cough, frequent wheezing, and ongoing shortness of breath. These symptoms can interfere with sleep, work, and daily activities. Chronic asthma requires regular use of controller medications and close monitoring by healthcare providers to maintain good quality of life and prevent complications. Some people, especially children, may experience remission of asthma symptoms as they grow older. Remission means that symptoms disappear for a period of time, sometimes permanently. However, asthma can return later in life, especially if exposed to new triggers or during periods of stress or illness. Even during remission, it is important to remain vigilant and continue regular checkups with a healthcare provider. Allergies and asthma are closely linked. Many people with asthma also have allergic rhinitis or eczema. Exposure to allergens such as pollen, dust mites, or animal dander can trigger asthma symptoms and make them worse. Managing allergies through avoidance, medications, or immunotherapy can help control asthma and reduce the frequency of attacks. Physical activity is important for overall health, but for some people with asthma, exercise can trigger symptoms. Exercise-induced asthma is characterized by coughing, wheezing, and shortness of breath during or after physical activity. Proper warm-up, use of preventive medication, and choosing suitable activities can help individuals with asthma stay active and healthy. Some adults develop asthma due to exposures in the workplace. Occupational asthma is caused by inhaling fumes, dust, chemicals, or other irritants at work. Symptoms may improve when away from the workplace and worsen upon return. Identifying and reducing exposure to workplace triggers is essential for managing occupational asthma and preventing long-term complications. Hormonal changes can influence asthma symptoms, especially in women. Puberty, pregnancy, and menopause are times when asthma may worsen or improve. Some women notice changes in symptoms related to their menstrual cycle. Understanding these patterns can help tailor treatment and improve asthma control during different life stages. Respiratory infections, such as colds or the flu, are common triggers for asthma exacerbations. Infections can cause increased inflammation in the airways, leading to worsening symptoms. Children are particularly susceptible, but adults can also experience infection-related asthma attacks. Vaccinations and good hygiene practices can help reduce the risk of infections and subsequent asthma flare-ups. Emotional stress can worsen asthma symptoms. Stress hormones can increase inflammation and make the airways more sensitive to triggers. Learning stress management techniques, such as relaxation exercises, mindfulness, or counseling, can help people with asthma better control their symptoms and improve their overall well-being. Asthma treatment evolves as the condition changes over time. Inhaled, corticosteroids, and bronchodilators are the mainstays of therapy. As symptoms change, medication doses may need to be adjusted. Some people require daily controller medications, while others use them only during flare-ups. Regular follow-up with healthcare providers ensures that treatment remains effective and side effects are minimized. Monitoring asthma symptoms and lung function is essential for effective management. Peak flow meters and symptom diaries help track changes and identify patterns. Early detection of worsening symptoms allows for prompt treatment adjustments, reducing the risk of severe attacks and hospitalizations. Consistent monitoring empowers individuals to take control of their asthma. An asthma action plan is a personalized guide developed with a healthcare provider. It outlines daily management, how to recognize worsening symptoms, and steps to take during an asthma attack. Action plans help individuals and families respond quickly and effectively, reducing anxiety and improving outcomes. If asthma is not well controlled, it can lead to long-term complications. These include permanent airway remodeling, decreased lung function, and increased risk of respiratory infections. Severe, uncontrolled asthma can also impact heart health and overall quality of life. Early and consistent management is key to preventing these complications. Asthma can persist into older adulthood or develop for the first time later in life. Older adults may have additional health conditions that complicate asthma management, such as heart disease or chronic obstructive pulmonary disease, COPD. Medication side effects and decreased lung function are also concerns. Regular medical follow-up and tailored treatment plans are essential for this age group. Asthma can impact many aspects of daily life, including sleep, work, school, and social activities. Poorly controlled asthma may lead to missed days at work or school and limit participation in physical activities. With proper management, most people with asthma can lead full, active lives. Education and support are important for maintaining a good quality of life. Nighttime asthma symptoms, such as coughing and wheezing, can disrupt sleep and lead to daytime fatigue. Poor sleep quality can make asthma harder to control and affect overall health. Addressing nighttime symptoms with appropriate medication and lifestyle changes can improve sleep and asthma control. Regular physical activity is beneficial for people with asthma, improving lung function and overall health. However, it is important to choose suitable activities and use preventive strategies to avoid triggering symptoms. With proper management, most people with asthma can participate in sports and exercise safely. Children with poorly controlled asthma may miss school due to symptoms or doctor visits. This can impact academic performance and social development. Working with teachers and school nurses to develop an asthma action plan can help children manage their condition and succeed in school. Adults with asthma may experience missed workdays or decreased productivity due to symptoms. Occupational triggers can make symptoms worse. Employers can support employees with asthma by providing a safe work environment and allowing flexibility for medical appointments and medication use. Living with a chronic condition like asthma can affect mental health. Anxiety and depression are more common in people with asthma, especially if symptoms are poorly controlled. Support from family, friends, and mental health professionals can help individuals cope and maintain a positive outlook. Asthma can impact family routines and relationships. Family members may need to adjust activities or living environments to reduce triggers. Open communication and shared responsibility for asthma management can strengthen family bonds and improve outcomes for everyone involved. Traveling with asthma requires careful planning. Changes in climate, exposure to new allergens, and access to medical care can all affect asthma control. Packing medications, having an action plan, and researching healthcare options at your destination can help ensure a safe and enjoyable trip. Pets can be a source of joy, but for some people with asthma, animal dander is a significant trigger. Strategies such as regular cleaning, using air purifiers, and limiting pet access to bedrooms can help reduce exposure. In some cases, allergy medications or immunotherapy may be necessary to allow people with asthma to safely live with pets. Smoking and exposure to secondhand smoke are major risk factors for developing and worsening asthma. Smoke irritates the airways and increases inflammation, making symptoms harder to control. Quitting smoking and avoiding smoke exposure are among the most important steps for managing asthma effectively. Poor air quality, due to pollution or allergens, can trigger asthma symptoms and make them worse. Monitoring air quality reports and staying indoors on high pollution days can help reduce exposure. Using air filters at home and avoiding outdoor exercise during peak pollution times are also helpful strategies. Weather changes, such as cold air, humidity, or sudden temperature shifts, can affect asthma symptoms. Some people are more sensitive to certain weather conditions and may notice increased symptoms during specific seasons. Dressing appropriately and adjusting medication as needed can help manage weather-related asthma. A healthy diet supports overall well-being and may help with asthma control. Some studies suggest that diets rich in fruits, vegetables, and omega-3 fatty acids can reduce inflammation. Maintaining a healthy weight is also important, as obesity can worsen asthma symptoms. Consult with a healthcare provider for personalized dietary advice. Long-term use of asthma medications, especially corticosteroids, can have side effects such as oral thrush, hoarseness, or bone loss. Using inhalers correctly and rinsing the mouth after use can reduce some risks. Regular checkups help monitor for side effects and adjust treatment as needed. For people with severe allergies that trigger asthma, immunotherapy may be an option. This treatment involves regular injections or tablets that help the immune system become less sensitive to allergens. Over time, immunotherapy can reduce asthma symptoms and the need for medication. Vaccinations, such as the flu shot and pneumococcal vaccine, are important for people with asthma. These vaccines help prevent respiratory infections that can trigger severe asthma attacks. Staying up to date with recommended vaccinations is a key part of asthma management. Pregnancy can affect asthma symptoms, with some women experiencing improvement and others worsening. Good asthma control during pregnancy is important for the health of both mother and baby. Regular prenatal care and close communication with healthcare providers ensure safe and effective management. As people age, lung function naturally declines, which can make asthma symptoms more noticeable. Older adults may also have other health conditions that complicate asthma management. Regular assessment and adjustment of treatment plans are important to maintain good control and quality of life. Ongoing research continues to improve our understanding of asthma and its treatment. New medications, biologic therapies, and personalized medicine approaches are helping more people achieve better control of their symptoms. Staying informed about advances in asthma care can empower individuals to seek the best possible treatment. Asthma is a complex, lifelong condition that can change over time. With early recognition, consistent management, and support from healthcare providers, most people with asthma can lead healthy, active lives. Advances in research and treatment continue to improve outcomes. By understanding how asthma develops and progresses, individuals and families can take proactive steps to control symptoms and enhance quality of life.